डॉक्टर नवदीप शर्मा नमस्कार करता हूं। पिछले 21 वर्षों से दुनिया भर में आयुर्वेद के माध्यम से मैं इलाज कर रहा हूं और आज मैं देख पा रहा हूं कि पूरा विश्व आयुर्वेद की ओर इम्यूनिटी बढ़ाने के लिए एक उम्मीद से देख रहा है। सदियों से ही हमारे यहाँ राजा महाराजा चांदी के बर्तनों में भोजन का सेवन करते थे अपनी इम्यूनिटी को बढ़ाने के लिए। तो आप सबके घरों में चांदी की पायल, बैंगल, पेंडेंट, कोई भी आभूषण हो, जिस पात्र में आप पानी स्टोर करते हैं उसमें वो डाल दीजिए। उस पानी का सेवन करने से आपकी इम्यूनिटी जो है वो बेटर रहेगी। शुंठी, मरीच, पिपली, ये 3 हर्ब्स जो किचन की शोभा बढ़ाती हैं, इनका इस्तेमाल अधिक कीजिए और भस्त्रिका क्रिया अधिक से अधिक कीजिए। इन चीजों का इस्तेमाल करने से आप हृष्ट पुष्ट रह सकेंगे और कोरोना नामक महामारी को दूर भगा सकेंगे।
हृष्ट पुष्ट रहे आयुर्वेद में माहिर डॉक्टर नवदीप शर्मा से जटिल रोगों का आयुर्वेदिक निदान पाएं। कॉल करें 7222006006।
When I was younger, I was very sensitive. I could feel the pain that people endured. My father once told me, "It's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief." These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer. And my journey with Ayurveda, the science of life, began. According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water and earth, and solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy, in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, yoga, diet has helped Dr. Navdeep Sharma create the brand Hrisht Pusht and Team Nirogam by treating thousands of patients suffering from chronic illness. Join Dr. Navdeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.
Hi, my name is James from Germany. Well, my friend Robert was diagnosed by hepatitis just before his marriage, and he was totally shattered. Then someone came and told us about Dr. Navdeep Sharma, who is an expert in giving natural treatment. At first we were skeptical, but we decided to give it a try. This February, when the final test result came for Robert, he was free from hepatitis. I want to take this opportunity to thank Dr. Sharma for giving Robert a disease-free life. And thank you very much.
I am Jonah from Nigeria. My uncle was suffering from hepatitis and we were guided to Dr. Navdeep Sharma by a friend who got well by his treatment. It took us 1.5 years to come out of the disease, and today my uncle is hepatitis free. Thank you, Dr. Navdeep Sharma.
Last July, when Dr. Navdeep Sharma was here in the United States, I was referred by a friend for his herbal treatment. Believe me, he's one of the best I've ever met. Such a great human being with immense knowledge in herbs. It was really worth meeting him.
नाम दिव्या दीक्षित है। मैं दिल्ली इंटेलिजेंस की रहने वाली हूँ। करीब 1.5-2 साल पहले मेरे बच्चे को काला पीलिया हो गया था। उसका नाम दीपांशु है। उसका सुन के हमें बहुत परेशान हुई थी। चारों तरफ मैंने ट्रीटमेंट के लिए जब परेशान हुई तो चारों तरफ गई मैं ट्रीटमेंट के लिए। सोचा कहाँ से कराऊँ। मैंने अंग्रेजी ट्रीटमेंट लिया तो लेकिन मुझे संतुष्टि उसमें नहीं थी। फिर ऑनलाइन मैंने देखा डॉक्टर नवदीप शर्मा है जो इसका जड़ से इलाज करते हैं, तो मैं वहाँ गई डॉक्टर के पास। मैंने उनको अपने बच्चे के बारे में बताया तो उन्होंने कहा कि आपका बच्चा बिल्कुल ठीक हो जाएगा। तब मैंने सोचा कि भगवान ने मेरी सहायता के लिए किसी न किसी को ज़रूर भेजा है। मैंने वहाँ पे ट्रीटमेंट करवाया, करीब 2 साल मेरा ट्रीटमेंट चला और अब मेरा बच्चा पूरी तरह स्वस्थ है। मैं भगवान से आशा करती हूँ कि मेरा बच्चा आगे भी पूरी तरह स्वस्थ रहे।
इंटरैक्टिव सेशन में मैं डॉक्टर नवदीप शर्मा आप सबका स्वागत करता हूं। अ वेरी वार्म वेलकम टू ऑल ऑफ यू इन दिस इवनिंग लाइव इंटरैक्टिव सेशन वेयर वी जनरली डिस्कस आयुर्वेदा विद यू एंड एज आई कैन सी ओवर हियर धीराज जी आपका प्रश्न है सिरोसिस के बारे में। तो बताना चाहूँगा कि आयुर्वेद के माध्यम से जो सिरोसिस है वो बहुत बढ़िया रिकवरी उसमें देखने को मिलती है। क्योंकि आयुर्वेद में जब हम लिवर की बात करते हैं, जिसे कि यकृत भी कहा जाता है, लिवर को, हेपेटोसाइट्स को रीजनरेट करवाने के लिए बहुत बढ़िया आयुर्वेदिक जो औषधियाँ वो उपलब्ध रहती हैं। और ऐसी ही कुछ औषधियाँ जो हैं उसका इस्तेमाल हमने कर रखा है यकृत निरोगम के अंदर। मैं आपको दिखाना चाहूँगा, आपने सिरोसिस की बात की है तो यकृत निरोगम आपको दिखाना चाहूँगा। देखिए आपके सामने आप यकृत निरोगम देख पा रहे हैं कि उसमें भृंगराज, चिरायता, भूम्यामल की काल में, काकामाची, शरपुंखा, विडंग, कुटकी, पुनर्नवा, दुग्ध पाषाण, भृंगराज, रोहितक, ये सब जो हर्ब्स हैं, और इन सब के साथ साथ वंशलोचन। वंशलोचन एक मिनरल है जो कि बहुत ही बढ़िया हेपेटोप्रोटेक्टिव है। वो वंशलोचन भी जो है वो इस यकृत निरोगम के अंदर इस्तेमाल किया गया है और बहुत ही बढ़िया जो है वो काम करता है। सीमा, मेरी आपसे रिक्वेस्ट है, ये माई व्यूज आईडी से जो क्वेश्चंस आए हैं प्लीज़ आप उस क्वेश्चन को एक बार पेस्ट कर दीजिए। मैं नहीं देख पा रहा हूँ उस क्वेश्चन को, तो आप प्लीज़ उसे एक बार दोबारा से पोस्ट कर दीजिए, मेरे लिए पेस्ट कर दीजिए यहाँ पे, ताकि मैं प्रॉपर जो है वो जानकारी दे पाऊँ। मोहम्मद खुर्शीद जी, वेरी गुड इवनिंग टू यू एंड वेलकम ऑन दिस लाइव वेयर टुडे वी आर डिस्कसिंग प्राइमरली अबाउट hepatitis, liver disorders, and along with that any question which you want a resolution with the help of Ayurveda, with the help of good Ayurveda, you are most welcome to ask all those questions from me. And along with this, the number which you are having on your screen, you can forward your reports on this number and I shall be trying to resolve those problems with the help of Ayurveda. So we are talking about hepatitis today, and when we talk about hepatitis, the most common type of hepatitis is hepatitis B. A very warm welcome to you, Shruta Swarna ji. Good evening. So when we are talking about hepatitis B is a disease in which a virus, which is a partially double-stranded DNA virus, the hepatitis B virus, which is also known as Australia antigen, enters the body, and that virus then slowly and gradually moves to the liver and it can then cause damage to the hepatocytes. It is one of the most common causes of liver cancers, liver cirrhosis in middle and adult aged persons. And to be honest, hepatitis B is a disease which needs to be taken very seriously right from the day one when we come to know about this disease. So it's very important that we take this disease with utmost seriousness. Seema, please, again I am requesting you, please paste the question of my views, or if you are there with us from the ID of my views, please paste your question over here once again, because unluckily before I could see your message it just went away, so I wasn't able to see your message, and in the meantime I am having some details which have been forwarded my way over here, and it is for Mr. Rajat Thakur. So the number is 81620 in the end. So welcome in this live, and you can ask your questions about hepatitis and other diseases. So when we are talking about hepatitis, generally when the patients they approach us, they have gone for a HBS AG test, which is known as Australia antigen, and it is that test which is showing positive, which tells the patient for the first time that he or she is suffering from hepatitis. Patient ID है और लिखा है कि सर आपके बताए हुए मेडिसिन ले रहा हूँ इन 2 months, बट मेरे को लीवर के साइड में कभी कभी हैवी और पेन फील होता है। मैं चाहूँगा सर अगर आप अपनी जो रिपोर्ट्स हैं और जो दवाइयाँ मैं आपको दे रहा हूँ या मेरी जो टीम आपको दवाइयाँ दे रही है, अगर वो दवाइयाँ आप फॉरवर्ड कर सकें हमारे इस नंबर पर जो कि आप स्क्रीन पर देख रहे हैं 7222006006, तो मेरी टीम आपको पूरा बता पाएगी। इसके साथ साथ अगर आप चाहें तो जो रिष्ट पुष्ट मोबाइल ऐप है हमारी, आप इस मोबाइल ऐप को भी डाउनलोड कर सकते हैं और इसके थ्रू भी आप डायरेक्टली मुझे अपनी जो रिपोर्ट्स हैं वो सेंड कर सकते हैं, मेरे साथ वो अपना केस भी डिस्कस कर सकते हैं। तो प्लीज़ मुझे आप बताएं कि क्या दवाइयाँ आपकी जो हैं वो समय चल रही है। So we are talking about hepatitis, and when we are talking about hepatitis, I just told you that it is the HBS AG test, which is also known as Australia antigen test, which generally is advised to patients suffering from hepatitis.
And it is this test which once the patients they go for and they see that it is positive, they now know that they are hepatitis positive. And it is from here that a lot of wrong guidelines they start. And I'll be coming to those wrong guidelines, that what exactly are those wrong guidelines which are given to patients when the patients they become HbSAg positive. But before that, Shrilata Swarnaji, your question, the Friday morning kidney dive session has been discontinued, doctor. Looks like quite a few recent changes that I missed. Yes, Shrilata ji, there have been a lot of sessions now that have been tapered down, and due to the reason that we have again started with Panchkarma also at Chandigarh, and with lots and lots of patients again starting, and especially the US, the Canada OPDs, the virtual ones which have already started. So I am not able to spare out that much time, and that is why I had to discontinue some of those live sessions. And what I have done instead is that I have started with some other live sessions on my behalf from the end of my team. One of them is of Dr. Ankita for neurology problems, and there are few which we are going to start very soon. मोहम्मद खुर्शीद जी, आप लिखा है, सर मेरे पास एक डब्बी यकृत बचा हुआ है, क्या मैं यूज़ कर सकता हूँ या नहीं, मेरे लीवर में कुछ तकलीफ तो नहीं है। मोहम्मद जी देखिए, जब हम यकृत निरोगम की बात करते हैं तो यकृत निरोगम एक ऐसी मेडिसिन है जो हमारे यकृत को निरोग करती है, एक ऐसी दवाई जो हमारे लीवर को डिटॉक्सीफाई करती है। तो एज अ सप्लीमेंट इसका लेना लीवर के लिए बहुत लाभकारी है। सो आप अगर चाहें तो इसे ले सकते हैं, इसको लेने का बिल्कुल नुकसान नहीं है, ये आपके लीवर को लाभ ही पहुंचाएगा। सो आई एम अगेन गोइंग टू द रिपोर्ट्स व्हिच आर बीइंग फॉरवर्डेड माय वे, एंड the name of the patient also I'll try speaking it out. The name of the patient is Pampori Shabir Ahmad. So Pampori Shabir Ahmad ji, the reports are there with me, and now that you have sent all the reports, and I also know that the name of your coordinator is Rajat Thakur, please ask your question also so that I can guide you, because it's a CKD patient, the reports are of CKD. So I would like if you can ask your question also over here. I would like to tell you in this regards. So I was talking about hepatitis B, and I was telling you that when a patient is suffering from hepatitis B, it is generally the Australia antigen which a patient goes for, and when the Australia antigen comes out to be positive, there are so many doctors in the world who will ask the patient that please go for a LFT, liver function test. A patient may also be advised to go for an ultrasound scan, and in some cases the patient is advised to go for a viral load, that is HPV DNA quantitative. So these are various tests which tell us various kinds of things. The LFT generally tells us that whether the liver enzymes they are deranged or the liver is perfectly working all right. It consists of various kinds of tests like SGOT, SGPT, alkaline phosphatase, serum bilirubin, direct bilirubin, indirect bilirubin. Lot many tests are done in KFT. And then apart from the KFT, the second is ultrasound scan, which can again give us some insights into the health of our liver. And there is a third test which is HPV DNA, which is generally advised by the doctors to see if the viral load is too much inside the blood. Now the problem which arises over here is that in case the LFTs are not very much deranged, and in case the allopathic doctor, he or she feels that the viral load is also not very high, in majority of the cases the patient is asked to wait. The patient is told that since the virus is not causing much problem, so the patient needs to wait, he needs not have any kind of medication. There is something which is very wrong approach, because if we know that the virus is there inside the body, I do not feel there is any reason in this world why someone should wait. Because if the virus is there inside the body, we need to throw that virus out. We need to fight with the virus before the virus divides too much. The virus goes inside the hepatocytes, and the virus starts damaging the hepatocytes. So that approach of waiting is something which is wrong. There are others where the doctor advises the patient with ARVs. They are known as antivirals like acyclovir, famclovir, virovir. These are antivirals. I am not naming exactly what is given in hepatitis patients, but I am giving you examples of antivirals. Now, in those patients where the doctor feels that the HBV DNA is on a higher side, they start with these antivirals. But the biggest problem over here is that these antivirals can definitely decrease the viral load in majority of the patients. But apart from decreasing the viral load, they do not give any major benefit. Moreover, with continuous usage of these antivirals for long time spans, they can cause a derangement of liver function tests. So that's why it is very important to start with the treatment, and secondly, to only and only start with the treatment which simply does not aim on reducing the viral load. Now that is something which is the most important thing. Any medication being given to a patient suffering from hepatitis needs to be hepatoprotective medication. The medicine needs to be containing all those herbs which can give a protective and a calming effect on the hepatocytes, so that along with fighting with the virus, we make sure that the medicine is not going to cause any major harm to the liver, and in fact, if there is some damage which has already occurred in the liver, the medicine is able to give a good recovery in that regards also. So that is what we generally try when a patient of hepatitis is there with us for Ayurvedic treatment. There is another test which I would like to mention over here, and the name of the test is HBeAg, that is hepatitis B envelope antigen test. There are so many people who go for HBeAg test. The HBeAg test turns out to be negative, and the patient is told that you are perfectly alright, which is totally wrong statement given by the doctors. When we talk about HBeAg test, the hepatitis B envelope antigen test, it only tells us that whether the virus is active inside the body or it is not active yet. So if the HBeAg test turns out to be positive, it simply means that the virus is active inside the body, and we need to be very active in fighting with the virus. But in majority of the patients, at least 80% of patients who visit us for treatments, this HBeAg is mostly negative. Then there is another test known as HBcAg, hepatitis B core antigen test. So these are various kinds of tests which are done for a hepatitis patient to ascertain the staging in which a patient is for hepatitis, and to see whether there is any kind of liver damage that has been done by this virus. But one thing which is very important over here, which we need to keep a check on, is that if we really want to see how much the liver has been damaged by this virus, the best test is fibroscan. A patient needs to go for a fibroscan to know this thing. A very warm welcome to you, Mustafa ji and Pankaj ji. Good evening. All of you can keep on asking your questions, and you can forward your reports also on the number which is there on your screen. So it is the fibroscan which gives us an indication of stiffness in the liver. The more the stiffness, it means that more fibrosis has occurred inside the liver.
and it means that the liver is damaged to a greater extent. So to know that whether this virus has damaged the liver or not, it becomes very important that if you are suffering from hepatitis, please go for a fibroscan after every 6 months. At least once in 6 months, a patient suffering from hepatitis needs to go for a fibroscan to see that whether the liver has been damaged by it or not. Now when we talk about the diet of a hepatitis patient, the first thing which I always guide my hepatitis patients is try being vegetarian. Try being vegetarian. The more vegetarian, vegan a person can remain, the better are the chances of immune system fighting with the virus. The second thing, take a minimum of processed food. Try being on non-processed foods. The more a patient remains on non-processed foodstuffs, the better it remains for the patient, and the quicker a patient recovers with the help of any treatment being taken for hepatitis. Mustafa ji, a very warm welcome, and as you have written that you have consulted with your parents and you want to start with the treatment the next month. You have also mentioned that, sir, I went to hospital on Tuesday. When they do urine test, I was having protein 1+ in it. So do not worry. If you were having a protein of 1+ leaking out through the urine, although leakage of protein is not good through the urine, but still 1+ leakage is not too high a leakage. So once we start the treatment in your case, I feel that you shall be able to recover in a very quick pace. So for all of you who are there with us during this live, and for all of you who will watch this video later on, I would request you that if you want any of the advice from my team of doctors, please do not forget to share your reports on 7222006006. Those reports shall be analyzed by my team of doctors, and if required, they shall be discussing your case with me, and then they shall be guiding you back in a proper way in that regards. So with these words, we come to the end of today's live session, and I really believe that with the help of guidelines that we have discussed, you shall be able to be more healthier in your lives. So thank you all for joining us today, and I really pray to the God, the Almighty, that you remain hrish push. हमारे साथ जुड़ने के लिए बहुत बहुत धन्यवाद। आप सभी हृष्ट पुष्ट रहें।
When I was younger, I was very sensitive. I could feel the pain that people endured. My father once told me, it's good that I can feel people's pain. It would be even better if I could transform one's pain into soothing relief. These words of my father nourished and nurtured the divinely planted seed in me to become a compassionate healer, and my journey with Ayurveda, the science of life, began. According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water, and earth, and solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy, in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, yoga, diet has helped Dr. Navdeep Sharma create the brand Rest Pushed and Team Nirogam by treating thousands of patients suffering from chronic illness. Join Dr. Navdeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.
एक योग्य आयुर्वेदिक चिकित्सक के अंतर्गत अगर आयुर्वेदिक इलाज करवाया जाए तो गंभीर से गंभीर रोग में वो एलोपैथिक ट्रीटमेंट से भी शीघ्रतापूर्वक काम कर सकता है।
किडनी, हेपेटाइटिस और अन्य गंभीर रोगों से जूझ रहे रोगी विश्व प्रसिद्ध आयुर्वेदिक चिकित्सक डॉक्टर नवदीप शर्मा को तुरंत संपर्क करें।
According to Ayurveda, our Panchabhautik body is an amalgam of space, air, fire, water and earth, and solution to all chronic ailments lies in balancing these body elements. As the origin of Ayurveda goes back to thousands of years, so some part of our ancient historical knowledge is lost. That's why I started my own research and shared it with the world. Ayurveda can give very quick recovery, even quicker than allopathy in most chronic ailments.
The blend of Ayurvedic medicines, Panchkarma, yoga, diet has helped Dr. Navdeep Sharma create the brand Rest Pushed and Tirobam by treating thousands of patients suffering from chronic illness. Join Dr. Navdeep Sharma's guided path of healthy living. Call now at +1 888 624 5925.